Good morning, Jill Franken, Public Health Director. I'm here today to give you a COVID response update for the City of Sioux Falls. I want to first take a moment to thank the many businesses and organizations who have been doing their part to promote social distancing. We've received actually only a handful of concerns in the community around whether businesses were complying with the no lingering ordinance. And when we investigated those through the health department, we found that everyone was in compliance actually. So really pleased to see that. We're continuing to do the part we can to monitor for compliance with that ordinance and really expect that we'll see full compliance in the days to come here. We're also really grateful that the communities around Sioux Falls are taking action, some have already taken action, some are taking action to also make sure that we are promoting social distancing and requiring social distancing similar to what we have with our no lingering ordinance. So the mayor and I have been talking about the whole concept of flattening the curve. And the fact that we're starting to collect some data around how we can understand this as compared to perhaps some other communities. So I just want to give you a little bit of information this morning about what we're exactly looking at. So first we decided to select some peer communities. Communities that we have selected are similar in city population, density, their population age ranges, and incomes that are similar to Sioux Falls. We're using U.S. Census Bureau data for that information, and some of the cities that we're including are like Fargo, North Dakota, Omaha, and Lincoln, Nebraska. Tallahassee, Florida is one. Des Moines, Iowa, Colorado Springs in Colorado, and Dayton, Ohio. These are communities, when you start really looking at all the demographics and the information around those communities, those are ones that we feel are examples anyway. There's quite a few more that we're actually looking at, but those are examples of ones that we think are peer communities to us. So using the number of cases identified in our comparison cities, we're determining cases per capita. I think it's important that we start looking at per capita rate when we start identifying how are we comparing. Knowing the number of cases, it's fine, but when you have a state that's 800+ versus several million in another state, you have to start looking at it from a per capita basis, and so that's what we're doing as well. And so we're plotting information that is including the first confirmed case for those communities, the dates when they implemented certain mitigation efforts, such as like emergency declarations, when they did school closures, public gathering size limitations, curfews, stay-at-home orders, and other mitigation efforts. So we're looking at all those factors and collecting all that data. We're also looking at where their cases have been trending over time since their day one of their first cases. So the information that we have, based on data from as recent as March 30th, so every day we're adding, and there's just going to be a little bit of a lag in this data every day that we collect it. We know that Sioux Falls right now, based on March 30th data, that we're at 13.18 cases per 100,000. Fargo is at 11. Omaha, Nebraska is at 20.2. Tallahassee, Florida is at 6.49. So just to remind you, Sioux Falls we're at 13.18 and Tallahassee is at 6.49. So we're really watching Tallahassee because their first case was actually identified the day after our first case was identified. And I'm going to give you an example of some of the mitigation efforts that they've used in that community, which might be indicative of why their cases are so low. They did a state of emergency on day 2 of their mitigation efforts, or on day 2 of when they had their first case. They actually limited public gatherings even before that, though, on day 1. They closed schools on day 6. They limited business. They had a limit on, this is an interesting one, they had a limit on business, no alcohol sales on day 7 of their cases being identified. They closed city buildings on day 13. And they had a stay-at-home ordinance or curfew on day 14. And so we're using this information and other information from other communities to determine whether there is something that we should be, some mitigation efforts that we should be looking at that can help us know that we are planning to do the right thing in our community, or should be planning to do the right thing in our community. We're also really relying on our strong partnerships as we continue to look at these mitigation efforts. So I'm going to just give you an example. You know, we're going to continue to look at whatever modeling the state is providing, as well as our health systems, and overlay that and be able to identify from when they think that peak is going to occur, which we should be hearing more about in the next day or two, and when that peak may happen. And so how far back should we be going to say this is the next action that we should be taking? So one thing I do want to say in regards to action is that we are having a special city council meeting this afternoon at 4 p.m. And at that meeting, we're going to update the city council on the most up-to-date data and information that we have about what's going on in Sioux Falls. We also have an ordinance that is going to be the date to conclude that ordinance, or the sunset of that, is on the 8th of April. And so we will be, at a minimum, bringing a recommendation for this will be first reading today at 4 o'clock. And we'll be recommending an extension of an additional about 2 weeks, or the April 22nd, for that particular ordinance. But we're also going to be keeping in mind the fact that we may need to amend that ordinance. And so that's something that just real time right now we're working on, and utilizing the information we're getting from other communities and what they're doing, as well as what we'll be continuing to learn from the state and our health systems over the next couple of days. So it's quite possible next Tuesday we could be offering or recommending amendment to that ordinance to include additional possible measures. So I want to just mention that. And so I also want to make sure that we continue to pay attention to what we should be doing as a community. The things that we should be doing that are so important: we should be continuing to social distance. That is really, the #1 message right now. You're hearing that across the entire country, if not world. That message about the things that we can do right now are going to make an impact for us as a community. Continue that good hand washing, continue that good respiratory hygiene, continue to stay home if you're ill, and please continue to be extremely vigilant about your social distancing if you're in a high-risk category. And have health conditions that would make you, more critically ill if you were to contract COVID. And please call your doctor if you have any concerns about whether or not what action you should be taking if you do become ill and you feel like you need to be seen. And then lastly, I just want to remind everybody, the parks, we did close down playground equipment or any spaces like shelters, playground equipment, etc., where people might congregate in our parks. But that means you can still, though, play in the green space. There's so much beautiful green space we have in our community, and we know people need to get outside, need to run, need to, kick a ball. Kids need to be able to go out and run. But we need parents to be monitoring our kids to make sure they're not congregating as they do so while they're getting outside, and make sure that, we use our bike trails, because the bike trails are still open, so that's a wonderful resource for us to be able to get out and get some exercise. So those are the main messages, and I'm going to leave you just lastly with a comment. I worked in the healthcare. I worked in health systems for about 17 years before I started working with the city of Sioux Falls, and so I'm very aware of the challenges that are being faced by our healthcare workers, not just in Sioux Falls, but across our state and our country, as they're preparing specifically in Sioux Falls for the surge. And so I'm particularly sensitive about that, but I also know that our leadership of our health systems are really working very hard to make sure that we are well prepared and that we are able to manage this, and we're partnering with them, and that's why we're doing the things that we are, is so that not only are we protecting our community, but we need to be protecting our healthcare workers as well, and making sure that they have adequate resources and that they are healthy to be able to care for all of us that may need those services in the weeks to come. So I want you to know that you all are on my mind and in my heart as we move forward here, and that we will be not just concerned about the community at large, but also about your welfare as well. So that's the end of my message for today, and I think we all need to be keeping them in our minds in the days and weeks to come. So with that, I'll take any questions you may have.
The 13.18 cases per 100,000, is that Sioux Falls or Minnehaha County?
That's Minnehaha and Lincoln County.
Together.
Yes.
So it's all of Lincoln County, all of Minnehaha?
Yes.
Because the population combined of those two matches the other demographics?
Yep, we had to look at data based on something we could compare, and so we had to start looking at county based on, rather than just city, because we're not getting data from the state based on city of Sioux Falls, we're getting it based on county. And so that's looking at that county jurisdiction area based on how, and so then we're comparing to other communities based on their county of where those communities are residing as well.
Can you talk about the different scenarios or what potential added measures could come? You talked about the ordinance. There could be more measures.
Sure. Well, I think I gave you some information on, some of the things that, like, for example, what Tallahassee is doing. They have a curfew in place. They also had some changes that they made to some of their other, I think that was probably for Tallahassee, the biggest change that they made was a curfew compared to what we're doing already. Things that we've seen certainly are, stay-at-home, ordinances or requirements. Those are some things that, we'll have to take into consideration of what we would be saying is the best recommendation for our community. We've done quite a bit already. When you look at what other communities have done, we've done those things already. There's just a couple more things that possibly could get us to hunker down even a little bit more. But those are decisions we'll be making over the next couple of days and bringing forward to the City Council.
Are forced business closures still on the table?
What?
We've talked a lot about that in the last week or so.
Well, I think I would say that based on information that we're seeing, probably looking at this as a community perspective of where you're seeing sheltering in place or, stay-at-home requirements, those are the things that we're seeing are probably the most relevant to what might be possible, or curfew. Those are the three things when you look at what else is possible in regards to your question, what else is possible, those are the things that we could possibly be looking at.
I don't know if Stacy wants to answer this, but would the hurdle be greater to force people to stay in their homes than close a business legally? I mean, if you're worried about getting sued for forcing business closures, would you also worry about getting sued for making private individuals stay in their home?
Well, and I bet Stacy will do a better job of repeating the question than I have thus far.
So the question is basically whether the city would be more worried about forcing people into their homes than closing businesses. Is that right? What I would tell you is this has been an ongoing analysis. Anybody who's followed this from a legal point of view from the state and the decisions that are being made there, and there are, of course, a lot of opinions how that should be done there and at the city level. What I would tell you is there's always concern about both. And, this isn't, there's always a consideration regarding potential legal liability, right? But what I can tell you when it comes to the mayor, and I'm sure at the state level, it's public health and safety. And so a lot of the debate legally or discussion has been regarding the city's police powers, because everybody agrees the city has those. The question becomes to what extent, right? And so that messaging at the city level has been consistent that we don't believe those powers are unlimited. And so the cities, I think, have been looking for ways to exercise those without getting into legal jeopardy Again, liability being one concern. So when you look at it on an individual basis versus a business basis, you've got constitutional components to both. First Amendment is a right to assembly. All the liberty components and that tension that I've talked about before between public health and safety. So I don't know if that answers your questions. I mean, there are aspects that are similar, but also there's obviously a difference when you're talking about people's and their homes and their lives and all that compared to businesses, but of course both are important. So, you bet.
Jim, we know about the hospitals, but can you talk about Falls Community Health? Is it still open? Are they still accepting patients?
Yes, Falls Community Health, which is our federally qualified health center that we operate out of the health department, yes, remains open, and we are actually, we have our own set of plans to prepare for a pandemic and know that we have vulnerable populations that are going to need our services when we see a surge. And we also believe that our patients are going to be quite sick because they do have, chronic disease and chronic illness, and the very nature that 50% of our patients are uninsured just make them more vulnerable. And so, we're ready as well. We're kind of seeing the same evolution that the health systems are, where we're seeing fewer visits to our clinic right now because people are staying home. They're not coming in unless they absolutely need to be. So unfortunately, some of the preventive care that you would otherwise be getting right now and making appointments for people, understand those need to wait a little while because we don't want our patients unnecessarily exposed. And so we're waiting and we're ready also for the influx of need that will be coming when we start surging as a community.
Are you doing testing there?
Yes, we are doing testing, yes.
Do you do that, or do you send those to the state lab then?
Yes, ours are going to the state lab.
The park closure, that was executive action, right? That doesn't require an ordinance or anything?
That is correct, that's correct, yes. And again, I'm not doing a very good job of repeating the question, but yes, the park policy that was enacted yesterday is executive action that can be taken by the Parks Director, Don Kearney.